Hi, everyone, and welcome to the Sex and Wellness Podcast with Dr. Mary. I am here. You can't see her, but she just jumped behind me. Miss Maya Papaya. For those of you that don't know her, she is a Yorkie poo. Anyways, so if you hear her, hopefully it won't be too loud. Anyways, so today we're going to talk about why do I have to pee all the time? This is pretty common, and I think that it's not normal, but it's common. And I think that we've almost normalized it in society that, oh, if you're a woman over 30 or over 40, you're just going to have to run to the bathroom all the time, and that's life. And that's actually not the case. There's a ton we can do in pelvic floor physical therapy to help with that. But also there's a lot you can do on your own even before going to pelvic floor physical therapy. And so some of those things I'm going to talk about here. So the common causes, what you can do to help it. And also I have a link below with a specific series of ways to monitor your bladder and track it so you can learn more about it. And so I'll put that in the show notes as well. But that one's pretty detailed. It's step by step. It's a bit different than the one that I posted a few weeks ago. This one is more in depth and step by step. So I put that in the show notes there. But all right, so why am I peeing all the time? I think we just assume when people have kids that their bladders are just kind of screwed up. And they're told, oh, maybe you have a weak bladder. That's not a thing. You know, maybe there may be weak pelvic floor muscles, but that's not always the case either. And so there's just a variety of things to do. One of the most important things to do is start paying attention to your bladder habits. And so what does that look like? Well, a lot of times when people come into the clinic, I'll ask them, you know, how often are you going? A lot of people don't necessarily know until they start kind of zoning in and looking at different things. So one of the biggest things is start kind of looking at what's your frequency, how long are you going, and is there anything that's irritating it? Like sometimes it can be, the most common thing would be alcohol as a bladder irritant, but it can be anything. There's specific ones that are common, but that doesn't mean that, you know, there's something different for you. So just keeping an eye out from that perspective. And then you can start noticing, hey, how often am I peeing? How long am I peeing? Am I waking up during the middle of the night to pee? Fun fact, waking up in the middle of the night to pee is not normal. It is not normal because you're getting older. It is not normal in general. And I'm not saying it's bad. What I'm saying is I refuse to accept that aging is a reason for pain or dysfunction. I think that aging sets you up to predisposed to different things, right? Maybe our injuries take a bit longer to heal. Maybe we, you know, take a little bit more time to build our strength or whatever goal it is. They are achievable. It just may take a bit more time, and it just depends on the person. Everybody's different. So if you have gone to somebody or a doctor or a healthcare practitioner and the first thing they give you is a medication to help with your bladder, I would say try some of this stuff first because it can happen pretty quick how much it can change. I've had a lot of people that I've seen just be shocked at how quickly just even looking at some of these things can make a big difference. And so some common causes are going to be sometimes, a lot of times it's really the lack of knowledge, just not knowing that, hey, you know, just because you feel the urge to pee doesn't actually mean you need to go. Versus, I think we were told years ago, maybe if you don't pee, you're going to get a UTI and you're going to die. I'm just kidding. Nobody said die, but I mean, we're scared. We're scared shitless sometimes. Like, oh, am I supposed to pee? Or am I supposed to do a Kegel? Or should I do this thing? Should I do that thing? The reality is you're being sold to left and right and left and right. And yes, people own businesses and things like that. But you know, it's one of those things where I try not to promote fear unless there's actually something like really going on that you would need to get checked out. But in general, you know, there's just specific things to just kind of keep an eye on, and everybody's a bit different. So decrease in education is a big one. The next thing is going to be a tight pelvic floor. And so that can happen for a variety of reasons, right? So if you think about like when you're stressed out about something, right? Your whole body is going to go into this fight or flight mode. When you're stressed out, your whole body goes into a fight or flight mode. And that just means it's going to tense up, right? So if you're constantly tense in every other body part, you're likely tense in your pelvic floor. You're likely squeezing your butt. You're likely clenching your teeth. And so it's important to note that just to start recognizing in your body when you feel that way, because the bladder sits on the pelvic floor muscles, right? So it's right around there. They're on top of it. It's shaped like a bowl, right? Your bladder's in the front, vagina, and then the uterus on top, and then the backside is the rectum. So they're all fighting for space, right? If you think about it, then if our muscles are tense, it's going to kind of put pressure on the whole area, which can also sometimes increase bowel urgencies as well. Those can go hand in hand just because of sharing space in the area, right? That increase of pressure, if you're constipated or you have an irritated rectum from a lot of diarrhea or whatever it may be, it will affect the bladder and vice versa, right? It may not affect it a ton, but it's not uncommon to kind of see those two things together. And that's why lately I've been talking more about hemorrhoids and constipation and all that. But, they all go hand in hand. It's not uncommon for somebody to have multiple symptoms. And it doesn't mean you're broken. It just means that, hey, there's some great things to work on and there's a lot of things for you to try. It just may not be available to you right now, or maybe you didn't know about it. And that's one of the reasons I do this podcast, is so people from all over the world will have access to information that maybe they wouldn't have had before, right? Because we've talked about how pelvic floor physical therapy isn't widespread and there's a limited amount of us. And then on top of it, finances and then having access. So there's some people that live in rural areas or different countries, right? So the good thing about all this is that our bodies are pretty much the same and they pretty much react the same. So across the board, these are different things that you can apply in your day-to-day. So the other thing that can be an issue, and this would be something to talk about your doctor, and I wouldn't address this until later if the person didn't get better, but a decrease in estrogen. So when the estrogen decreases, you can get the tissue just gets a bit more irritated. A lot of times that can sometimes cause bladder urgencies around the urethra. It can also cause potential weakening of the pelvic floor muscles because a decrease in estrogen can decrease our strength. So in those cases, that's something I will address a bit later, but most people, will focus on everything else first. I tend to be a bit more conservative with my treatments. Sorry if I feel like I've been congested and I feel like I'm short of while I'm talking, but anyways, so that's one potential reason as well. Another thing can be pelvic pain. Sometimes when you have pelvic pain, what happens is, again, those muscles tense up. Pelvic pain can also include low back pain, SI joint pain, hip pain. These are common as well. And I want to say the difference between, we talked about leaking with exercise before. This is a bit different. So leaking with exercise tends to be due to a lack of coordination of muscles. It can be impaired single leg stability, impaired form, etc. But an urgency is the need to run to the bathroom where you feel like you're going to pee your pants, right? So another cause of it can be anxiety around worrying about peeing your pants, right? So if you have almost peed your pants or you're constantly running to the bathroom and then you don't know if you're going to find a bathroom, right? That increases anxiety on top of it. Then it's kind of this spiral. I've definitely been there. I went through IVF treatments years ago. And after that, I just felt like my pelvic floor muscles or whatever it was, this was before I was a pelvic floor PT. I was running to the bathroom. I could not, it was just a big difference. I've had to manage this on my own, and it's usually by modifying how much coffee I drink and reducing my stress. I can tell that my bladder urgencies increase when I'm stressed, so I use that as a cue to pull back and slow down a bit. Another common cause will be medications. So just kind of keep an eye on what medications you're on. Could there be side effects from that? Everybody's a bit different, especially if you're on a diuretic and sometimes if you're on a stimulant, right? Because the stimulant may increase your overall body tension, which can then increase your pelvic floor muscles and then the bladder urgencies. So those are a lot of the common causes. There's potentially different reasons, but those are the common ones like that we'll treat in physical therapy. But some things to kind of consider if you feel the urgency to pee a lot, right? Potential UTI. We want to make sure that you don't have a UTI. And so, is there pain when you pee? Is this a sudden onset? Has this been gradual, right? There's a variety of different things that could set us up to think a UTI, right? So a UTI it could be a kidney infection, so urinary tract infection. So it's your kidneys to your ureters, which are basically tubes that then go down from the kidneys, to the bladder. And then the bladder, everything comes out of the urethra. So we want to make sure that, hey, there's no signs of a kidney infection, which include, which is under the UTI umbrella, a bladder infection, where's your pain? If your pain is in your mid-back and you're having urinary urgencies, your kidneys are right behind where your ribs end. So just kind of the sides of the low back, closer to the spine. And so we have two kidneys, and so we'll be on either side. And some people may not have a functioning kidney. Some people maybe only have one kidney. So obviously that would change for people with those conditions. But other than that, you could have a fever, right? Burning, pain, blood in the urine, different things like that. So consider those things as well. But a lot of times the people that have come into the clinic, they've already ruled that out. But another thing too to consider is blood sugar. So a sign of potential diabetes can be an increase of frequency to urinate. So I just want to bring up those things when in reality that a majority of people that have come in, they've already, had that screen done, or maybe it's been going on a while and they don't have the UTI symptoms. And so they're wanting to help with the urgencies. So that's something to think about from that perspective. We did mention before in the UTI episode that one of the commonly missed things in elderly people is an increase of confusion, which can be due to a UTI. So it's really important that if you have a family member that's older and they have a sudden change in confusion, that's usually a common symptom of that as well. That goes for anybody, but, confusion and drowsiness and a lot of different things, but specifically in the elderly population, it's not just because they all of a sudden started aging overnight. It could be a UTI. So something to consider from that perspective. But yeah, so the next thing to kind of think about is, we talked about bladder irritants, and that could be a variety of things. The most common ones are going to be caffeine and alcohol. The next thing would be identifying what your triggers are, right? So I'll give you an example. I went to Portugal, and I know that if I drink caffeine, that my bladder gets irritated. And so we were on this mountain. I just laugh because, I didn't know how hard this hike was going to be. I didn't realize it was 7 miles at an incline. And, I had just adjusted to the time change here in Austin. So I think it was like 6 hours ahead of time. And I was just exhausted. But, what I'm trying to say is that there were no places to pee anywhere on this trail. Nowhere. And the thing took us about 2 hours or so, maybe a little bit more. And so I knew ahead of time that, hey, I know coffee irritates my bladder. So I'm going to be careful about drinking coffee before I go on, this hike, because I don't want to be the only person peeing in the middle of nowhere. What's funny, and this might be TMI, is that by the time we were able to get to the top of the mountain, there's a bathroom and an area to stay there, which I thought was pretty cool. Anybody that goes to Portugal, I'd have to get the name of the mountain that we did. But it was in Madeira, and it's an island off of Portugal. But anyways, so, holding in your urine or having a bladder irritant can also upset your GI system too. So it was funny because I had to stop when I got up to the mountain because my stomach hurt pretty bad. And it turned out I was so dehydrated from not drinking that my stomach just got really irritated. And then I guess the change in the altitude. So anyways, it's just interesting when you start knowing what your triggers are, you can have more control over it. And so like if I didn't have that hike, I would have had coffee, right? Because I'd have access to a bathroom. This is regardless. There's bladder irritants for everybody. I just know I'm more susceptible to them ever since I had that IVF treatment. And so, or the IVF cycle. So that's super important, right? Because yes, changing the urges is one thing, but a lot of times just having the education and knowing, oh, okay, I can plan around this, right? Maybe if you're having to wake up in the middle of the night to pee, maybe we have to look at what's happening before bed. How much water are you drinking before bed? Are you, excuse me, how much water are you drinking before bed? Are you having sparkling water? Are you having alcohol? What does that look like? You might be able to tell, oh, okay, if I had this before bed, then in that case, maybe the next night I have it a little bit earlier, or I have it earlier in the day, or I hold out on it completely until I get my bladder symptoms more under control. The more you can train your bladder during the day, the less likely you'll wake up at night, because the bladder learns to expand and contract. And so if you're keeping the bladder small, you're not getting that relaxation of the bladder and then the contraction. And so it's limited in the amount of fluid you can intake. Well, maybe not the fluid it can intake, but it limits your ability to expand your bladder because it's not used to it, right? So that's when, if we keep going pee every time we feel the urge, we're not going to train the bladder to kind of expand and allow the urine to fill into the bladder. So that way we can wait a longer period of time. Most people, generally speaking, will pee every 2 to 3 hours. And so that just depends on the person. Obviously, if you're outside exercising and you're drinking a ton of water, like yesterday I played tennis and just chugged a bunch of water. So of course, volume in equals volume out. So in that case, I had an increase of fluid in my bladder, so I had to pee. So there's that aspect as well. But as a baseline, you want to have about 50% of your body weight in ounces in fluid. And that's not, fluid doesn't include like any caffeine or alcohol. So mostly, generally speaking, other things like water, maybe some tea, if it's non-caffeinated, maybe some juice, or it just depends on what your choice is. It's keeping an eye on those things as well. So once you learn the irritants, then you can start taking control over your symptoms, so you're not worried about waking up in the middle of the night or worried about peeing wherever you go. Another thing to think about with triggers is not just bladder triggers like drinks or food. Triggers can be like, the most common one I'll see is people pulling up into their driveway. They're like, I have to run into the bathroom the second I pull in the driveway. And so once you start identifying those, then you can start doing some techniques like diaphragmatic breathing or sitting on a rolled up towel to help relax your pelvic floor muscles, or just slowly walk yourself to the bathroom, because the second you start running, you're likely going to pee. If you try the breathing when you're already about to pee your pants, it may not work. So you almost have to do it preemptively, especially if you know there's a trigger. So that's really important as well. The other one would be people having anxiety when they don't know where a bathroom is. That can be really scary for people, because I had a patient who wanted to walk her granddaughter about 1.5 miles from her house to her parents' house, but she was super scared because she didn't want to pee on the side of the road. There wasn't anywhere to pee. And so, that can really limit somebody's lifestyle, right? Because if you can't do the day-to-day stuff because you're worried you're going to pee your pants, that can affect your ability to spend time with your grandchildren, your friends, or hiking, or whatever it may be. The other thing to think about with bladder urgencies often pair with stress urinary incontinence. So stress urinary incontinence is when you cough or sneeze and you pee or you jump. And then bladder urgencies, so urgency incontinence, tends to be with the stress incontinence. But where we want to focus first when we have that is the urgency. Because when we have the urgency, we know that it's likely could be tight pelvic floor muscles or just needing to retrain the bladder. And then sometimes that can resolve the stress urinary incontinence. So like the jumping and all those things, because then people start recognizing, oh, when I jump after I've had like 3 cups of coffee, then I leak. So maybe before a workout, coffee is a non-negotiable for a lot of people, including myself. So I won't tell people not to drink coffee unless it's absolutely, sometimes it can cause, painful bladder. So if you have painful bladder syndrome, that's when that is another episode. But the point is, when you have a chronic condition like that, sometimes caffeine and things like that need to be scaled back for a period of time if you're having a flare up or not. Or sometimes people have to really substantially decrease the amount of bladder irritants they have indefinitely, or at least for the short term, depending on their flare ups with their symptoms. But for a day-to-day person that is just running to the bathroom, you want to think about having bladder urgencies. One of the things that you want to think about is if the bladder is really irritated, right? Let's just use an example. If I cut my finger and I kept reopening it over and over again, it would take forever to get better. So in the short term, I may bandage it up, or I may just not move it as much so it can heal, right? So the irritation can decrease. And I use that as an example for pretty much most things in physical therapy, but especially when there's an injury or you're having symptoms like a bladder urgencies, we can't see that, right? In our finger, we can see it, but in our bodies, we can't. So it may be that if you know that your bladder is continuously getting irritated and you're running to the bathroom constantly, you've tried the deep breathing, you've tried the pressure on the perineum, so the area between the anus and vagina, and you're still having symptoms, then I would say, okay, we may have to go a bit extreme and really cut out most or all of the irritants that bother you specifically. I want to make sure that people know that this isn't long term. It's just that we're cutting back, right, to allow the bladder to heal and decrease the irritation, just like that cut. And then you can start adding it back in, because it's hard not to live without coffee or things that we love, right? And so easing those things back in, but you can tell if you already know based on the bladder diary or the bladder tracker that I have in the show notes, you'll know already certain things are already your triggers. So if you know that, hey, coffee irritates my bladder, but then I have a spicy pasta or spicy sauce with pasta, and I know spicy stuff irritates my bladder too, that's might be an overload for you at that time. And again, these tend to be for people with a really irritated bladder, or they're not showing significant progress. Then I go to these extreme. I say extreme, but generally a little bit more intense of a weaning out to wean back in. So then as you do that, then you can start recognizing, oh, okay, these things are irritating me, but as I gradually ease them back, I'm fine. And so that's a big thing to consider as well, is that it's short term for long-term gains. And then finally, if you feel like, you've done all the things, you've gone to pelvic floor PT, you've really looked into a lot of different things, and you know that, okay, maybe you're approaching perimenopause, or you're menopausal, or you're postpartum, all of these things cause a decrease in estrogen. So it may be something to consider talking to your doctor about. And when you use the vaginal estrogen, you should also rub it on your urethra because there's different blood supplies there. So it's important that you do that. I do see that's a big common mistake people make is they shoot it up into the vagina, but yeah, it can get onto the urethra, but it needs to almost be put directly on there. So that way the tissues can kind of heal a bit more and it can help you with some of that irritation and then the urgency symptoms. But some ways you can tell if you may have a decrease in estrogen would be it feels a lot of vaginal dryness. You're in one of the phases of life that I mentioned. It could also be that you can feel or you can see your vulva and the skin might look a bit irritated. Sometimes it has a palish color compared to the rest of the area. Those are some common symptoms that people will have. And sometimes it's like reoccurrent UTIs or recurrent infections. So if you have those, then it may be something to talk to your doctor about with the estrogen, but it's not for everybody. So it's something to think about from that perspective. And then finally, if you're on a medication that irritates your bladder, you're not shit out of luck. You just may have to be careful with other bladder irritants and just kind of manage it based on what your goals are, right? So maybe, a glass of wine irritates your bladder and then your medication irritates your bladder. Maybe you just make sure that, you're near a bathroom when you're out and you have that glass of wine versus maybe if you're on a plane ride, you may not want to do that, right? If the toilets, I don't know, every time I'm on a plane, I swear to God, the lines for the toilets are insane. So, just something to consider with that. But you could still use these same techniques. You can still use the bladder tracker. You can still do all these things. It just may be that, you can get to a certain point, but it's still irritating your bladder. But at least you can still manage it with these other symptoms, right? Because I don't want you to think, oh, I can't do anything because of this. Honestly, you may do fine. It may not be an issue, but it may be something to consider, but I don't want you to give up on it just simply because you're on a medication that might increase your bladder symptoms. But know that, a lot of people deal with this. A lot of people are silently dealing with this. But what's interesting is that, with social media and TikTok and Instagram, more and more people, authenticity is really coming out. And people are just being more open about things that they're going through because the more that we talk about these things and the more that we educate people, the less people feel alone. And we know that after COVID, there's been a huge shift in, the world was turned upside down. And as we kind of get back to quote normal, whatever that is, we need community more than ever. We need to feel heard. We need to feel like nothing, we're not some outcast because we have bladder symptoms or we have bowel symptoms or we're having itching or things like that. There's things to help with that. Everybody gets it at different periods of time, right? It's just a matter of having the education to know about it. But, the last thing too, maybe I said that already, but the last thing is if you also have reoccurrent or you're peeing a lot, we talked about UTIs, we talk about medication. But also just make sure that, if you've slept with a new partner or anything has changed in your relationship status, it may be good to just get an STI check. The best time to get that is about 3 months or so. Some doctors say 6 months, but 3 to 6 months after you had unprotected sex with your last partner. But again, I'm not a physician, so don't, always talk with your physician first. But generally speaking, around 3-ish months or so is going to be that ideal. And, try not to worry if that's something you're concerned about. There's a lot of things that people can do now for STIs and the treatments are, there's a lot that can be done. And a lot of people have STIs and they don't talk about it either. So it doesn't mean you're dirty. It just means that nobody else is talking about it. But anyways, the more conversations we can have with people, the more we can make everybody just feel like they're not alone. And that's why I love doing this podcast because I love talking about taboo topics. Maybe I just say this too much. I don't know. The messages I get are just keep going. what you've done has really helped me and changed my life. The messages I get from people and then my patients in clinic, I get positive reinforcement every day that where I'm going with this podcast and where I'm going with my practice overall is the right direction. And so it's been quite crazy lately, but we just moved into a 2,000 square foot space in west, for those people that don't know, we're in Austin, but it's west of Austin. And it's a beautiful facility. So it's been a bit crazy for me lately. And I want to get, I'm going to get a lot of the questions for 2024 lined up. I would love any input or questions that you guys are having that's a reoccurring thing that you'd like to address. And I'm open to playing, around with different types of podcasts. So, when I first started, I was having a lot of other people on the podcast, the questions that are coming in, and I'm open to all different types of things. But so that was going on. And for those of you that don't know, I had Hodgkin's lymphoma in 2019. And last week was amazing because I got my scans. I got my scans and they were clear. So there's no signs of cancer for me. And, there's nothing else in this world that matters more than your health. I just wish I prioritized that a bit more before I got cancer. I was running around with my head cut off. I was in an unhealthy relationship. I was putting everybody else first. Years before that, I was working for corporate, treating like upwards of 18 people a day, getting 2 weeks off of work a year, and, 18 people a day. And that's not including all the paperwork and stuff like that. And, it wasn't always 18. And the last place that I worked was great, but I had to still treat 2 people at the same time. And you do that over and over again and your body gets exhausted. And this is unfortunately why we see more burnout in healthcare. And then I switched to my practice. So I see less patients and they come less often because they tend to get better faster because there's so much more time with them. So we decided to close our north location. It was more like consolidate the 2 locations. So that way we're all together. We added a 3rd physical therapist. Her name is Arista. She's been great. Then we have Nick as well. And then our social media, Rachel, she's been amazing. And then Cameron is actually out this week because she got married over the weekend. So congrats, Cameron. And it's just been really exciting. And I hope if you guys are in Austin, I'd love for you to stop by. My plan for 2024, I'm going to say it so that way I stick to it, but I really want to start having community events at our space because we have the space now. And like I said, a lot of people have broke away from the communities because of COVID. And then we get social anxiety and depression, all these different things. So I want to bring people together. So I'll keep you guys posted on that. If you are in Austin, or even if you're visiting Austin, you're definitely welcome to join, but I don't have any of that set in stone. So anyways, like I said, I have the link below for the Bladder diary or the Bladder tracker. I spent a lot of time putting that together, and so hopefully it will work great for you guys. Either way, I'll see you guys in 2 weeks.